Well, good evening, everyone. This is Dr. Ellithorpe from Tustin Longevity Center here in Southern California. We are a integrative functional medical office, 7 healthcare providers, and we're all amazingly, overwhelmingly busy. And we are just grateful to be a help and to try and prevent illness and recover from illnesses, and to optimize our life, our functions, and our purposes here. We meet Monday at 6 o'clock for an hour. We have an email system at the bottom of this video. You can email our office at TLC, or the link is there for typing in questions. So some of you have typed in questions, and I have quite a few, so I'll go into those tonight. This is not meant to be medical advice. This is meant to be how I would approach a general concept, or topically generally approach some of the questions that you might have. This is not replacing your time with your medical doctor or your healthcare provider. If you have urgent problems, please see them or see the urgent care. But in general, we're trying to open this up so that we can get a dialogue and be a greater support and provide another venue for our patients and our families and our friends. If you find this valuable, please like and subscribe and share, and please leave a comment or even type questions into the comments section there. This also helps promote the channel and what we are trying to do. So today is September 12th, 2022, and I am Dr. Ellithorpe, founder of Tustin Longevity Center. But we have 7 wonderful and a brand new doctor. Dr. Johnston is just joining us tomorrow, new, and you'll be seeing him shortly, as well as we'll try and get him on some of the videos as well. So it's nice to have a male doctor with us, 6 women and our staff here. So we will begin by answering some of the questions on here. Wendy says, is it possible to reverse non-diabetic peripheral neuropathy? And the answer is always, we never say never in medicine. At least that's our philosophy as preventative and functional integrative doctors, because the nerve, if we can find out what's irritating it, very often it could be compression, very often it might be heavy metal toxins, it could be toxic environmental exposure, it could be lack of microcirculation, it could be inactivity, it could be drinking too much water, it could be drinking too little water. So there are so many things that are associated with causative features that aggravate the nerves, because they are lined, they're covered with a fatty membrane called a myelin sheath. And this is made of sphingomyelin, a very special type of phospholipid. And we have been shunned away from eating, from bad medical advice, our healthy fats that help us to repair these cell membrane surfaces. That's why we're always showing the pictures here about the injured and then the repaired cell membrane, by eating a very healthy fat and supporting digestion. So the answer would be yes, see a functional integrative doctor, and they can help look at all these other reasons for non-diabetic peripheral neuropathy. And I would definitely look at heavy metal toxicity. Stephanie asks, what is the best supplement or practice to have a healthy gut microbiome? I have read that it is very important for my immune system. Is that correct? Thank you. The answer is there's no one best supplement. The diet in America is driven by a marketing business, and that means the business wants to use the cheapest available foodstuffs and the most attractive to the taste, the most behavioral, that will make you repetitiously reconsume it over and over. And very often these are the sugar or the excess salty or the saturated hydrogenated fat substances that create prolonged shelf life. And so this marketing of these processed foods harms the lining of our gut. We are taught behaviorally to cave into our appetites and passions. We are taught to follow extremes in gratification in taste and flavors. These are all damaging to us, and we wind up not eating at home or taking the time to plan menus and to cook for ourselves and our family. This damages us. So we would begin by telling you that the more simple you eat, if you eat grass-fed beef, grass-fed free-range chickens with the skin on it, that is roasted, not deep-fried, wild-caught fish, grass-fed, field-raised pork, dairy that is raw and not pasteurized, eating pork that is wild-raised. These are sources that are tremendous because we're made of protein and fat, and the lining of your gut is a one-cell membrane-thick lining between the world and you when you bring it into your body. And so you have to eat these rich phospholipid and proteins, these healthy fats, to repair yourself every day of your life. And these synthetic processed foods are teaching a lazy, adaptive behavior for just driving taste sensations in us that are high carb, and they all damage our immune system. So we would focus on your diet. So if you ate a simple protein and a simple vegetable or two, a very simplified salad, trying to get away from all these salad dressings and get back to olive oil and vinegar, and have a nut for the day or a berries. And I say berries because we're so full of sugar. I don't recommend the very sugared up apples and peaches and oranges and melons and stuff. There's so much high fructose corn syrup that we've gotten damaged from all these processed foods. So if you have a meat-themed day with a vegetable, then the next day a chicken-themed day with a vegetable, and next day a fish-themed day with a vegetable, next day be a pork-themed day with a different vegetable. Fifth menu might be an omelet or an egg day with a different vegetable. And then rotate between these 5 menus. Maybe you could train yourself to fast 1 day per week, and then maybe limit yourself to a treat day. So that covers 7 days right there. But the more we simplify our menu, reduce the variety of spices and processed foods, the more the lining of our gut can heal, and the immune system, 88% of which lines that barrier, is going to be preserved for taking care of the rest of your body and really getting those carbs down, because that really damages your immune system. Now, probiotics, there's now more and more information, more people are learning this, and I can't test every product out there, but we have here what we have clinically tested. We have done research and gone to the sites of production and looked at process for these things. So we use orthomolecular, a broad spectrum multi-strain supplement probiotic. We also use one of their items called Orthospore IG, which is another wonderful product, but there are many good ones. We carry about 5 different varieties. The money you spend on it or whether it's refrigerated really is not the key. We have to work on things that we find actually are being tested, and we actually test, and then we look at the stool. So I would recommend the company Orthobiotic, Orthospore IG, those kind of things. And I would go from there. Diane says, what are your thoughts on taking baby aspirin in general, and specifically in regards to taking it to help avoid COVID? I have a friend who was advised by her doctor to take it daily to prevent COVID. I never heard of that, nor have I. Just wondering your thoughts. Well, aspirin is a antiplatelet to help prevent clotting, and the spike protein of the virus, coronavirus that is circulating, is a inflaming in the coagulation pathway. So it doesn't prevent it, but it helps reduce the microclotting that might occur. Now, what we suggest is drink your filtered water, drink enough every day. Half your weight as pounds as ounces. So if you're 150 pounds, you would take 75 ounces a day. That will work to help detox you, to help prevent clotting and so forth. Then the other thing is systemic enzymes, which will help do many cleansing, anti-inflammatory actions. Aspirin acts as an anti-inflammatory, where enzymes are designed to do exactly the same thing and prevent the microclotting and so forth, and help to keep the blood slightly thin. But we're emphasizing enough water. Take your systemic enzymes every morning on an empty stomach, an hour before you eat anything or before bedtime. I use mine morning and evening. At my age, almost 70 now, I really need to take my enzymes because we make so much less as we age. And as we age and we have these limitations, this is why we eventually die. I think the life expectancy for an American woman is around 82 or 84, and for a male is 78. But I think those numbers are declining now. But remember, the spike protein promotes damage of the lining of your blood vessels, which promotes microclotting. So that's the logic to taking a baby aspirin. But there are many risks of indiscriminate platelet reduction and bleeding. Why not take things that your body needs, like your water, and reduce your carbs so you're not creating sticky blood, and reducing your immune system, and take systemic enzymes. If you want to prevent COVID, I would get a good night's sleep. I would have a routine where you're trying to get to bed by 9 o'clock, 9:30, and up early. I would exercise regularly. We know regular exercise and weight training is associated with stimulating the white blood cell production, mitochondrial production in your immune system. We know reducing your carbohydrates improves the function and mobility of your phagocytes of the white blood cells and your immune function. And we know that quercetin is a herb that acts as a ionophore, like ivermectin and hydroxychloroquine. We know that taking zinc in a multivitamin mineral, anywhere from 6 to 25 milligrams a day, is a antiviral action, just like quercetin and the other items. We know taking vitamin C acts as an antiviral. We know that vitamin D has immune protecting, bone building, as well as antiviral support by enhancing your immune system. That's where I would spend my time. Linda says, first of all, Dr. Ellithorpe, I would like to thank you for all that you do. Thank you, Linda. You have been just a great support and joy to myself and my family. Thank you for your enduring service. Well, God bless you, Linda. You and all you TLC Health Freedom Tribe people are why we do this. I have a question about my eyes. I have recently started playing pickleball, and with this heat, I sweat a lot, and I think the sweat gets into my eyes, and also perhaps the air conditioning in my car may bother them. But my eyes hurt. They are a little itchy, and they feel good if I just close them for a while. The itch and slight stinging go away. Is there something you can recommend for me? As we age, the cornea, the lining over the glassy part of our eyes, is about 1 cell thick. And so when you blink, every time you are, so to say, using like a windshield blade wiper, and the blade and the windshield gets oxidized by the ultraviolet light radiation on the rubber on the windshield. Same with our eyes. That cell membrane gets older. Taking antioxidants, we like the product Juice Plus here for its broad spectrum, powerful, research validated antioxidant power. We also like drinking enough water to help you. But we also encourage natural hormone replacement therapy, which aids in cell repair and reconstruction. And we also like systemic enzymes that helps clear out old debris or injured cells. By closing your eyes stops that trauma of wiping them. And so when you are playing sports and the saltiness of your eye drips in, that creates some irritants in these tiny micro cracks. You'll notice as your skin gets older and cracked, you can get more itchy. Very often there's a pruritus or itching of old age. And we often ask people not to shower so much so that the salt and stuff will not go deep into these cracks. By letting your natural oils build up by eating healthy oils, taking Pure and Essential Oil, we use the capsule form of clinician's preference. I use Argentine Silver for my eyes at night. Most every night I put a drop in my eyes before I go to bed to decrease the viral, bacterial, fungal, exposure I've had. But I use all these things, low carb enzymes, my natural hormones, systemic enzymes, my Argentine at night, my natural hormones, and that's about the best we can do to try and take care of our vision. So why don't you keep a drop, a little eyedropper bottle, and put a drop in your eyes and just close them for a minute or so after, feeling irritated, and try and get a good night's sleep every night, and that should help keep up with it. Debbie says, I'm 66. I've had chronic osteoarthritis in both my knees due to many years of beach volleyball and other body abusive sports. After years of prolotherapy, PRP injections, and mostly recently stem cell injections, I've come to the conclusion I now need total knee replacements. My MRIs show advanced grade 4 arthritis. However, I probably can't get surgery until early next year. My question is, how detrimental to my health would it be to receive cortisone knee injections? I've always been against those, as I'm aware of the contraindications. However, I have several trips upcoming, and I want to be able to enjoy them without flooding my body with over-the-counter painkillers. I know they can harm existing cartilage, but I have none, and if I get replacements, does it really matter? I've been a patient of a doctor on your staff for many years. I currently follow the carnivore diet partially. I take all the supplements faithfully that are recommended. I continue to be very active on an advanced level of pickleball, but the pain and the time off needed to recover is getting to be too much. Thank you so much. I love that you keep God in the forefront of your life. Well, God bless you, Debbie. My thought, I presume that you're taking systemic enzyme and drinking enough water every day. I don't know if you're on natural hormone replacement therapy, but that is a help. Getting a very good knee support sock to put socks on your knees and pull them up to try and reduce some of the pound per square inch. Maintaining an optimum weight for your body would be valuable. But getting a cortisone shot in light of what you're describing seems reasonable to me. I think you probably can only get a few shots in the course of time. Often they'll last a couple, 3 months, so maybe that'll give you enough space and time to get you to next year to your knee replacements. But a knee sock helps even reduce a half per pound per square inch pressure on the knee. These support socks that you just pull up tightly over your knees when you have to be out and about. The added water, the systemic enzymes, the natural hormones, and the cortisone shot is probably a reasonable choice. So I'm not saying not to do that, and I hope it goes well for you, Debbie. Amela says, good evening, Dr. Ellithorpe. In one of your YouTube videos, you mentioned a bioidentical progesterone cream that you've used for many years and that would be suitable for even teenage girls. I can't recall the name of it. It's called Kokoro progesterone cream. It's over the counter. It's low dose progesterone. It doesn't need a prescription. Kokoro, and it comes in a pumper thing, and you can see it right here on my shelf. You can see the pink and the aqua. These are the natural progesterones. This is what I use usually for the teenage girls, early 20s. And I tell them to use it day 15 of their menstrual cycle. Day 1 is the beginning of their menstrual cycle. So the first day they start bleeding is day 1. 2 weeks afterwards, on the 14th, 15th or so, they start rubbing this as a moisturizer cream, 2 to 4 pumps on every night, and do that for 10 nights in a row. And that tends to help regulate their menstrual cycles. Let's see. So it's called Kokoro progesterone cream. And my daughter started out with her period at 13 every 3 weeks for about a good 2 years. Now that she's older, 17, she gets her period about every 40 days. Is that considered normal? That's a little long. Usually a menstrual cycle is considered roughly normal between 21 and 36 days apart. I wonder if she could benefit from the progesterone cream. Absolutely she can. Remember, stress will stop and inhibit ovulation, and then you get no progesterone produced, and then you're just getting slough off of the uterine lining from the estrogen that you have. So progesterone is designed to clean the uterus out and to balance off, put a block to the stimulation of the natural estradiol. If you are under a lot of stress, many people are, then that cortisol inhibits follicle-stimulating luteinizing hormone. Therefore, there's no follicle stimulated, therefore no progesterone. So using it day 15 through 25 of every menstrual cycle is very, very smart. I wonder if she could benefit from the progesterone cream. Yes. I am not sure if she's too young. No, she isn't. If so, how much could she use? Well, I think the jars say 1 to 4 pumps, but really you could use, 2 to 4 to 6 to, there's no toxic impact that I'm aware of over using it now over 30 years. So it's quite safe. The next patient says, hi, Dr. Rita. God bless you always, and thank you for all you do. My total cholesterol is 300, triglycerides 87, HDL 91, VLDL 14, LDL 195. Should I be concerned? No. Now, I don't know exactly who you are, but a total cholesterol of 300, I'm not worried about, especially when your HDL, high density lipoprotein, is 91. If you divide 91 into 300, it goes 3.2 times. So you're in a normal risk ratio. The only thing I'm concerned about are your triglycerides of 87 and your HDL of 91, and they're both balanced, and the triglycerides are lower than the HDL. When the triglycerides are lower than the HDL, really, there's no possibility that I've ever seen in literature for heart disease to develop. The LDL, if you get that subfractionated and you look at particle size, if you wish, you probably make the large, fluffy, non-heart risk LDL, but it looks very good. And then you said, what is alkaline phosphatase? Well, that's a bone and a liver gut kind of enzyme. My result says low, 42. Well, that's good. High alkaline phosphatase is what would bring a concern, not something low from the average. So low means nothing. What is AG ratio? Minus high, 2.4. Well, it's really not high. The albumin globulin ratio is saying how much of the protein in your serum is a junk protein called albumin that's available for snipping and using, kind of like a delivery truck going around all the time for household repairs in the communities and with protein. So albumin's like a generalized junk protein, and you have a certain amount, and your globulin is a more specific antibodies subcomponent of that. And so they look at these ratios mathematically. A 2.4 is nothing to be concerned about. Is all this related to cholesterol, or is this thyroid issues? It's nothing, and don't worry about it. If you have a concern, see your doctor, because I don't know you in particular, but if this were my blood, I would not worry. Your age matters, your exercise matters. I can see you're not eating a high carb diet because your triglycerides are only 87 and your HDL is 91. So exercise, stay on a low carb diet, go to bed on time, drink plenty of water, don't get dehydrated, and you should be fine. All right. Cynthia says, down my back, just left of my spine, I feel shaking in my body, like quick moving, side to side shaking in a straight line down my back. That also goes down my left leg. I can even feel it in my sleep at times. Is there something that you can think of that would cause the symptom? Well, this is a neuropathy. This is some perception of yourself and your body of nerve impulses. So I'm going to say it's a atypical or unusual pattern of description. I have never had a person describe something like this. So I also had blood work done. Everything came back normal with the exception of a high B12, which really shouldn't be a problem. Is this something to be concerned about? Well, Cynthia, I would say I would have to see you, what your age is, if there was any trauma, are you on any other medications, and what your inflammation molecule, lab looks like. When you say all your lab, they checked. If they just did a chemistry and a blood count, then that's not very much. So, how long has this been going on? Is this getting worse with time? What are the triggering events? What are the events that seem to be when you don't perceive it? This sounds like a neuropathy, and this sounds like you should have your heavy metals checked for lead, aluminum, because you can get these kind of manifestations of neurological tremulousness with heavy metal concerns that are building up in your life. I would see your doctor, see a functional integrative doctor, see a doctor who can do chelation therapy and measure that and go from there. Megan says, I tested positive for COVID in June and had mild symptoms. Then September antibody test was negative. Why should this be? I assume after having COVID, I would have the antibodies. Well, you're assuming that the test you took over the counter or whatever they use for testing to claim that you were COVID positive is a valid test. And so I have suspicions of that test and its validity. So really don't, if you had mild symptoms, never in my life and at almost 70, I never went to a doctor for a cold. I never went to have anything checked out for mild cold symptoms. And they have trained us to do this. If you feel healthy and that you're recovering from mild congestion, flu-like symptoms on your own with healthy, fluids, rest, and taking your vitamin D and your vitamin C and your zinc, then I wouldn't test myself. So that's probably why you didn't have antibodies. Just don't use that over-the-counter test or trust the test. And again, there are many scientific articles that came out saying the test itself, the PCR testing, some of the antibody cross-reactivities of these tests are invalid. So I would not give it a second thought. Megan says, I test. Okay, that was Megan. Carol says, Does taking vitamin B help you build up an immunity to bug bites? I am really allergic to them, mosquitoes and spiders. If not, do you have any suggestions besides using Argentin after being bit? Well, um, there's arguments that thiamine, vitamin B1, um, help to repel insect attractiveness. Um, I'm not sure if this is a question to prevent or once you've been bitten. Because once you've been bitten, already have the venom injected at the site and the irritation is there. Then anti-inflammatories and lots of water are valuable to prevent secondary infections. Argentin topically, ice packs also help that. So, but prevention, things like having fans on in your bedroom so mosquitoes can't fly and land in quiet air. To keep your screens for your windows. Don't have lights right next to your screened-in windows that would attract bugs to land on the screen and then wiggle through the little holes. Another thing is to have stagnant water in your house removed. Don't have pots and plants with water in them where mosquitoes can have their little larvae and they grow up on your little plants. Growing mint, if you grow mint, lavender, I think, is another one. Some of these thyme is another one. Thyme, mint, lavender. I think there's a couple others, but these the smell repels them. Some people get mint in an essential oil and they spray it around their doors and over their window screens. And then keeping plants away from your house right up on the edge of them is something that helps prevent it. So hopefully that helps. Lynn says, hello, Dr. Rita. What is your feeling towards glutathione? Do you see any benefits of it? Thanks, Lynn. Well, I think glutathione is, of the antioxidants, one of the notable ones. There are many important antioxidants, but it is a very powerful human mammalian antioxidant. You make it yourself too in your own liver. It's involved in so many things, and it's in every cell of your body. It's involved in helping with the DNA repair and protein synthesis and your immune health and, even detoxing and mental acuity. Well, anything that's going to help any cell. You could say the same for water. Water helps everything I just said glutathione does, but nobody makes a stink about water being so important. But glutathione is one of the big four antioxidants, and I take it myself. I take a 500 milligrams twice a day. I take its precursor, N-acetylcysteine. I also take CoQ10. I take Juice Plus, that antioxidant series. What else do I take? I think that's all I'm taking as far as antioxidants. And so it does many wonderful things. So I think the older we get, the more we need it to help slow our aging process. Pamela says, could you say again where you get unpasteurized butter? I use organicpastures.com. Organic Pastures, it's a farm in Central California. We've had the owner of that farm come here and lecture in the past. Maybe we'll get him again. And I go to Sprouts. At Sprouts is where I get the Organic Pastures. And that's what it's called, organicpastures.com. Jackie says, why isn't it recommended to use progesterone cream day 1 through 15 and only 15 through 28? Well, I think that's a misunderstanding, Jackie. The menstruating woman, a girl who is menstruating, if we call the first day of her period menstrual cycle day 1, then you don't want to suppress natural ovulation. So they always recommend for younger women who use progesterone to start it on day 15, because ovulation is not going to occur after day 15 from the start of a menstrual cycle. And that's, are we talking about young women, or are we talking about postmenopausal women? So I use progesterone day 1 through 15 of a calendar month because I don't ovulate anymore no matter what. So at my age, it doesn't really matter what my pattern is. So I could use it the 10th through the 20th of the month if I wanted it to. But being regular is all that's important. So I think what you're saying is, if, Jackie, you're young, you want to use it between day 15 and 28, because if you're having a menstrual cycle, you don't want to start it any sooner than day 15, so you get the benefit of natural ovulation. That's what that's all about. June says, my husband developed peripheral neuropathy and a balance problem after getting vaccinated. He had 3 enhanced chelations last month and has noticed a big improvement in his balance. Amen. Praise the Lord. Why is that chelation would help with these medical problems? And how many more chelations would you recommend to further help with the problem? Also, do you have other recommendations besides chelation? Well, remember, the vaccination, so-called, is a mRNA technology housed in a capsule polyethylene sphere that is taken into the cell, and that's then mRNA is released, and it is taken up by your own cell ribosome for reading and producing the message on that messenger RNA, which is to make spike protein. And we are seeing reports in the scientific literature that spike protein is being made not just days or weeks, but we're seeing it many months afterwards. So we don't know. They were true. They were at least honest. They didn't, well, maybe they were dishonest, but it was implied that it would stay in your deltoid where you got the shot, but now we know it's everywhere. They don't know the exact volume of production, how many cells will take this up and produce this over your body. Hence, we'll have differing severities of production of the inflaming, cardiovascular, irritating spike protein, and the duration. We certainly don't know how long, but now at this point, we understand is several months, if not even more. So there are papers that validate these findings at this point in time. Fortunately, EDTA chelation is a anion. The spike protein is a cation, and so it attracts and draws it out. So that is a blessing. Other things that will help is continued chelation, maybe doing this once or twice a month for the next 6 months just to maintain your gains. The other thing would be to take systemic enzymes like Vitalzyme, Vascuzyme, anti-inflammatories, drink enough water, low-carb diet. And I would probably also take vitamin D and quercetin and zinc to build up your immune system so that you'll be able to fight off other viral illnesses. But see your doctor about that. Gladys says, how much leucine is required to stave off muscle wasting for a 61-year-old woman? I noticed that my arms and breasts and the small of my back, where there usually are fat pads, are now bony now, and my scalp face looks like I have facial wasting. When I intermittent fast, I just eat only 1 or 2 meals a day and not the 3. I have lost over 10 pounds too quickly, and I'm 5 foot and now 88 pounds. I'm typically anywhere between 103 and 109. After I eat, I knock at the dinner table and I'm too tired to walk upstairs to my bedroom. Thank you, Dr. Ellithorpe. Well, it sounds like, you're short 88 pounds. You need all of the 9 amino acids and essential fatty acids. So I would emphasize eating, let's say, between 10 a.m. and 6 p.m., a 8-hour window time, and eat 3 meals, and then just don't eat after 6, and you'll get 14, 12, 13, 14. yeah, 14 hours of intermittent fasting in there, which is beneficial. But you really need to eat a lot of fat. Fat has 9 calories per gram. Protein and carbohydrates have only 4 calories per gram. So you need to maybe take a tablespoon of olive oil intermittently throughout the day, even during the fasting time. Butter up your foods liberally. Eat the fatty meats, the fatty fish. Eat the fat like in the bacon and the pork. Um, Eat the skin on your chicken to get all that fat in you, and that should help you. As to an exact amount of leucine, I don't know that number off the bat. We have a product called Perfect Aminos. Perfect Aminos was designed by an older gentleman, Dr. Meinkoff, who is in his late 80s. And he has won triathlon after triathlon for his age group, many, many of them. And he developed this amino acid to maintain his muscle mass. Now, you have to do resistance training. You have to do resistance training to stimulate those muscles to rebuild and grow again. So twice a week, at least 20 minutes. Get the Perfect Aminos. It comes as a powdered or as tablets, whichever you prefer. And I would probably use it twice a day with those higher fats in your diet and resistance training, and follow up with your doctor and get a body mass index so we can track, or your doctor can track your gains. Karen says, Dear Dr. Althorpe, a friend of mine has a nephew who is 9 years old and had a sudden onset of cavernous sinus thrombosis. That's a blood clot in the head. He has been on IV antibiotics and blood thinners and now seems to be doing better. There has apparently been no consideration of what may have caused this, but he did have the vaccine, and it happened after that. Well, I'm not going to make a comment. This is not a matter that can be touched with the family. Are there any recommendations you would give to help restoring his health? I would certainly recommend he come in for chelation therapy. 9 years old, he probably weighs 60, 70 pounds. We could do 25 milligram per kilogram of EDTA, and that will help. He should be on systemic enzymes, and he should get healthy fats to rebuild the lining so they're not inflamed. What is the way to find doctors that will give chelation therapy in other states? I would go to acam.org, 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 and explain the situation that you have a child that needs that, and hopefully that will bless him. And you can see in the other lady, June, her husband had a problem after that, and it helped him greatly. Manja said, hello, Dr. Althorpe. My daughter is 14. She started having a stomach pain from August this year. Pain is sometimes sharp and sometimes regular. She noted that she is having more pain when she eats dairy products, but sometimes even without eating that, she would still have pain. Her doctor ordered breath tests for H. pylori bacteria and stool tests. She tested negative for everything. But her calprotectin level was 246, which indicates inflammation in her colon. Her doctor just said for now to avoid dairy for 2 weeks and watch the symptoms. If it gets worse, then she is thinking of sending her to a gastroenterologist. What would be your approach to this situation? Is the level too high to indicate something more serious? Thank you. I appreciate all you do. Thank you, too. We appreciate you and all of the TLC Health Freedom Tribe here. I would get her blood type and find out what her blood type is. I would have her take the NT powder with SBI Protect. NT powder is the phospholipids, the fat that builds the lining of the cell membranes. I would take a scoop of that and I would mix it with the SBI Protect powder. And then I would probably put in a little bit of the essential oil that helps heal the lining, and do that first thing in the morning and last thing at night. You could do it anytime you have the pain. So if there's a breakthrough pain, you could take another dose of it. This is food. Phospholipids repair the cell membrane, and the SBI Protect is the immunoglobulin proteins that are in the gut to help the immune system, and the oil is the actual fatty acid lining in the cell membrane. So that's God's natural acids, and try and get her to eat a simplified menu like we talk about. Have a meat and vegetable, nut and berry themed day, and then a chicken, different vegetable, a different nut and a different berry themed day, and then a fish and a different vegetable and a different nut and a different berry, and have her eat a more simplified menu, and that should help her. And she could use the NT powder with the SBI Protect and the oil, many times a day just to keep that quiet, and it should heal up. That should give you enough time to get to a doctor with her who can be familiar with functional medicine and check these things out. And after about a month of using that, or 2 months, it takes about 2 months in a younger person like that. If you're an adult woman in your 40s, 50s, or 60s, it takes about 3-4 months. But children heal quicker, and so a month or 2 of doing that should greatly help her, Manja. Gloria says, hi, Dr. Rita. Wondering if our alpha lipoic acid is also a good choice in lieu of alpha lipoic acid. Thank you for your time. Well, our alpha lipoic acid, levo and dextro, is the rotation of mirror images. So these are my hands, and they're a mirror image of each other. And our body likes the levo as a general rule. So our alpha lipoic acid, I'd have to check my biochemistry again. I don't recall if it's the R or the L that is the most beneficial. If you see a product that says alpha lipoic acid, then it's called a racemic mixture, meaning it's an equal portion of the left and the right rotating forms of the antioxidant. It's very, very powerful. I don't have a statement other than our alpha lipoic acid is very, very powerful. I use it both in my TLC metabolic formula, and we have alpha lipoic acid separately, but we don't specify whether it's an R or an L because it's probably a racemic mixture, but very, very good. That's about all I can tell you on that, Gloria. Megan says, hi, Dr. Rita. I had maybe 10 chelations at TLC, but didn't finish the set of 30. Is this dangerous not to finish? Are the heavy metals just sitting in my tissues instead of being all the way pulled out? Thank you so much, Debbie. No, every chelation anyone does is a long-term benefit, and it reduces your total body burden. No, it doesn't put it like on a cliff to be expelled into your blood serum, and it just sits there until it comes. Your body tries to tuck your toxic metals, toxins into your fat and into your bones, where it's the most inert and least likely to do damage. So good for you that you got at least 10 done whenever you can get them done. I started at age 16, almost 70 now. I probably have had many hundreds of these. Sandra says, I'm an 80-year-old woman with atrial fibrillation. I have had a pacemaker for 11 years and taking warfarin, lisinopril, carvedilol. I am also supplementing my daily diet with vitamin C, D, zinc, B12, and potassium. I choose not to take the COVID vaccine. 11 days ago, I self-tested positive for COVID, and again on the 5th day, and again yesterday on 9/11. My temperature was about 100 for the first 5 days. Now it's stable in the normal range of 97.7. My blood oxygen is 98 to 99, and my blood pressure is holding steady around 110/65. I am still having COVID symptoms, runny nose, a slight cough, headaches, low backache, also fatigue, and loss of appetite. My question is, how should I to proceed from here? Should I continue even after 11 days to isolate or wear an N95 mask when I'm out in public? I am concerned to be around people, but I live alone, and it is sometimes necessary to shop for food. How long could I expect to be no longer contagious, and do I need to continue to isolate until I have tested myself negative? Any advice much is appreciated. Thank you for the time. you consider to answer my question, Sandra. Well, you sound like you are asymptomatic, and even the CDC has reversed and said asymptomatic people are non-contagious. If you're not actively coughing and sneezing all the time throughout the day, you are not contagious. You know my opinion on the testing. I think the test kits are not reliable. And so I don't know what you had, or maybe you're having allergies right now. So I would feel blessed to be relieved to go out into the public and do your shopping and take good care of yourself. It sounds like you are, with fantastic vitals at your age. You might consider seeing your doctor, getting on some ivermectin or hydroxychloroquine, or using them preventatively. And you might consider coming to a place such as ours and doing a high-dose vitamin C drip. But I would certainly say these symptoms of a runny nose and a light cough certainly doesn't put you in a position where I'm concerned for you being someone who's infecting the environment, and I don't trust the over-the-counter tests. So at 11 days and 80 years old and on the nutrients you're on, I think you're probably doing very well and can go out. So oxygen of a 98, 99 sounds like you're doing quite well. But you can call your doctor and ask for the Z-Pak and ivermectin, or Z-Pak and hydroxychloroquine. And of course, if you were to worsen, I would see the urgent care. But I think at 11 days, you've done a remarkable job. Amela says, you mentioned once that there is a biochemical progesterone cream that's over the counter. I think I answered that already. Yeah, that was the Kokoro. Denise says, hi, Dr. E. I hope you're doing well. What might help combat strong headaches resulting from Omicron infection, BA5? Also, is thin, brittle hair a result of hormone changes or vitamin mineral deficiency or something else? 66-year-old female on bioidentical estradiol progesterone. Thank you for all you do to keep us healthy. Well, it is the way of the life that over time, the protein that goes into our nails and our hair is diminished. Muscle is lost and wasting. And so the body will put less into our less needful features like our nails and our hair thickness. Using natural hormones is helpful to support this. Vitamin mineral deficiencies. Well, yes, you could have a thyroid problem. You could have some mineral deficiencies that are associated, iodine deficiencies, but you have to see your doctor to look at that, and these are really rare. I think this is a matter of thinning of the hair of aging at 66, but I'm glad you're on natural hormones. Now, what would help combat a strong headache? I wonder if you're drinking half your weight in pounds as ounces of water every single day, if you're getting a good night's sleep, and if you're on enzymes, systemic enzymes like vascuzyme. I would take 5 twice a day on an empty stomach to disinflame the body. I would fast for 1 day, just take chicken broth or beef broth and see if just disinflaming your body, that will help calm everything down. And the same for the headaches. Whenever I get ill, I just stop eating for a day, and I just came off my 5-day fast and did quite well. I didn't make it quite to the 5th day, but almost, and so I did a heroic job at that, and I did all my workouts 5 days a week, everything I normally do, and worked full time. So I'm glad that I made it to the 4th day and did well. So try fasting, try the systemic enzymes, be sure you're on the water, get a good night's sleep, and see your doctor and see if there might be some other issues there. So that, I think, covers all the questions here. Dorothy says, what does Dr. Johnston give for injections for? When will he be available? for consultations. Happy belated birthdays to Talon, Dr. Rita, and her husband. You are penetrating the darkness. Don't worry about the darkest deeds. God is in control and is on our side, fighting our battles for us. Our greatest battles are not ours. Okay, so amen to that, Dorothy. And thank you for the belated birthday. Yes, we will have Dr. Johnson will be here tomorrow, and I will talk with him. I think he does a lot of the ozone and prolo injections, things like that, PRP, and we would have to get set up for that. So he's excited about doing things like that, as well as seeing the general medical questions. Let's see, what do we have here on the list? Sean says, hi, Dr. E. Can you discuss causes of hernias in the groin area of older male patients? How is it diagnosed and treatments, including surgical? Are there any functional medicine options? No, once you tear the fascial lining of the abdominal wall, that's a tear. So there isn't a functional solution for that. Now, how big is the tear is the big question, because the concern would be the bowel could try and slip through that tear, and if it gets pinched off and then that bowel can't move and it gets inflamed, then that could be a medical emergency. So that's what they get concerned about with inguinal hernias. And a general surgeon can look at that, or a urologist. You would get a total male exam, and they would feel in your groin around your scrotal sacs. They will have you bear down and cough, do those various things. And if it's small, they just observe you and watch, and they tell you don't strain or do any very, very heavy lifting, straining. They might give you a truss. Some men put a truss on to support their abdominal wall. But I would see a urologist or a general surgeon and ask them to check out that groin and see if there is a hernia or not. But if the pain progressively gets worse and sustained, I would go to the emergency room or urgent care. But often these are small and functional and really don't need any treatment. They don't want you straining with a hard stool. Drink your water, keep your stool soft with plenty of water and fiber and magnesium. Rosita says, hello, Dr. Ellithorpe. I was wondering what advice you would give men specifically to make sure they're fertile, and advice to couples trying to conceive a boy. Well, alcohol I would not drink at all, because that raises a man's estrogen. And so I wouldn't touch alcoholic beverages. Number two, I would eat a low-carb diet and eat homemade meals. In other words, have a meat-themed, protein, vegetable, nut, seed day, and have that for all the meals, just that one menu. So the more simplistic with healthy proteins and fibrous vegetables, healthy fats that are in the seeds, and they're usually rich in the zinc as well, and meats and fish and pork and chicken and organ meat and eggs are all rich in minerals, which are very important for men to have spermatogenesis. I would do that. Drink enough water and get enough sleep at night, and do 20 minutes of weight resistance training twice a week. That would be the bare minimum. And that's where I would start. The other thing, if you can get a hold of some Juice Plus, the antioxidants in the fruit, vegetables, and berries are very anti-aging and promoting just overall health. Lee C says, I'm on TLC estrogen every day and progesterone cream, the 1st through the 15th, one click, both creams for 8 months now. More acne on my face in recent months. What should I do to reduce acne? Well, we would want to see if what your testosterone level is on your DHEA, if you're taking DHEA, what your carbohydrate level, insulin, fasting blood sugar, triglyceride, hemoglobin A1C is. I would take Argentine silver and spray the face where the it kills virus, bacteria, and fungi on the face because we always have it on us. And I would never eat late at night. And then see your doctor so that we could check those things about you and see how that acne looks. Fred West says, did you say to only eat one nut a day, varying every day? In other words, like one day you would have walnuts for what you nibble on in that day. The next day you would link your nuts or seeds up differently, and maybe they'd be pecans. The third day it might be almonds. The fourth day might be sunflower seeds. So it's thematically, you have a menu where whatever your protein, vegetable, berries, and seeds or nuts are, that's all you eat for that day. You don't mix them all up menu to menu to menu and have 3 or 4 nuts or seeds in one day. That's the idea there. Julia says, hi, Dr. Ellithorpe. I met your sister a few weeks ago. Wonderful. And she told me about your live stream videos. I was wondering if you had any advice for dealing with COVID-19 vaccine injury. Systemic enzymes, Vitalzyme or Vascuzyme twice a day on an empty stomach, a low-carb diet. Drink half your weight in pounds as ounces every day. Go to bed early. And if it's possible, find an acam.org doctor who does chelation therapy to improve the microcirculation. Take quercetin, about 400 milligrams twice a day. That's an herb that works as like ivermectin, or it works like hydroxychloroquine. Take zinc and take vitamin D and eat a very low carb, healthy diet. That's how I would begin, Julia. I've been dealing with severe chronic hives ever since I got the booster. I would appreciate any advice. Well, your immune system has been triggered, so I would try and fast also, maybe for 24 to 48 hours. Just be on chicken broth or beef broth and rest your whole immune system, taking your D, your zinc, your quercetin, your vitamin D, zinc, quercetin, and your systemic enzymes, and see if things don't calm down with a fast for a day or two. Debbie says, I would like to donate blood to revitalize my body maybe 2 times a year since I do chelation 1 to 2 times a month. How will that relate to blood donations? You'll be donating healthier, better blood, so it'll be just fine. Dolores says, hi, Dr. Rita. How are you? Family member with PCOS, polycystic ovarian syndrome, started to take 2 Vascuzyme and she felt sick. She stated she will cut it down to 1 a day. What are your thoughts? I don't think it's related to the Vascuzyme, but everyone's unique. She can drop it down to 1 on an empty stomach twice a day, and then after several days she can try 2 twice a day. And she probably should be using progesterone cream day 15 through 25 of her menstrual cycle. She should be on an extremely low carbohydrate menu. She should not eat late. She should exercise twice a week with some resistance training to bring down the insulin that stimulates the cystic ovaries, and follow up with her doctor. That's how I would begin that, Chris. All right, so we've gone over 7 o'clock. I'm going to wrap this up, and Deborah Lass adds in, do essential fatty acids help irritable bowel symptoms? Now, it depends on what you call essential fatty acids. If you're talking about fish oil, DHA, EPA, no, the answer would be no. But if you're talking about parent essential oils, linoleic and alpha-linoleic acid, the answer is yes. So there you go, Debbie. And all right, Deborah, also, I called ACAM, and they are supposed to let me know when I'll be doing the lecture for teaching the doctors, and they'll give me a schedule. So Talon will be scheduling that and get us a room there so we can, I'll be teaching there at ACAM. And so I'll get back with you. I haven't forgotten your question on that. And also the check is in the mail. All right, I love you. God bless. God bless to all the TLC Health Freedom Tribe here. and read your Bible. All right, take care. Bye-bye.